once a week cooking.
Hey Turds, welcome back. We are thrilled to be here, and we have a very exciting case, and all I know about it is it's about nitazoxanide.
Nitazoxanide.
Nitazoxanide. Zox like socks.
Nitazoxanide.
Yeah.
Got it.
Nitazoxanide.
Yep.
That's going to be a struggle for me, guys, because I've been saying nitanoxanide.
It's really close.
One more time.
Zox.
Nitazoxanide.
Can you spell it?
Yeah. She's not good at spelling.
Okay. Well, it has
Give me one more time.
nitazoxanide.
Nitazoxanide. Okay. So this case, I'm going to tell this case in two parts because the first time I ever saw the patient was probably like 7 years ago. So let me start the case then. And then there's a big gap and then a follow-up. So I had this patient come in and she was probably like 27, 28.
Okay.
Her underlying diagnosis, her primary diagnosis was scleroderma. But she was coming in to see me for chronic diarrhea. She was having Bristol 7 bowel movements nonstop at night, multiple times a night, during the day, multiple times
at night, like while she's sleeping.
She was having bowel accidents. She would wake up multiple times to have bowel movements.
Sweetheart.
Yep.
Oh.
And she was 27. She was very young, but they had been trying to have a baby for 5 years, 6 years. She got married very young. She just assumed because of the scleroderma, she was infertile. So she came in to see me and she had had a colonoscopy. Colonoscopy was completely normal, nothing found. She had a full panel workup by the gastro, lots of imaging first. They kept all the stool panel tests, the PCR tests, like everything was done. They could not find an underlying cause of why she was having diarrhea. No SIBO. I'm like, I might have actually even seen her for the first time before I even knew SIBO was a thing.
Wow.
Like she was a very early on.
Yeah.
She was a very early on
the
patient.
Rates of SIBO are higher in folks with scleroderma.
That makes perfect sense.
And CFO.
Because they can't move. The intestine can't move.
Yep.
That makes perfect sense. So I did what I did, which is I ran a stool test. She wasn't having a bunch of bloating, interestingly enough. She did have chronic reflux. And then her other underlying thing was a familial hypertriglyceridemia, but there's nothing I can do about that. So she wasn't having a bunch of bloating. So I ran a stool test.
Okay.
She had been dealing with this diarrhea prior to seeing me 3 years, 4 years.
Sudden onset?
Slowly worsening.
Okay.
But she had been waking up 2 to 3 times a night to have bowel movement. She was pooping all day long.
Which is usually like an alarm sign for colitis, right?
They scoped
There
her.
was nothing.
They scoped her. They did a colonoscopy. She went through the full workup long before ever seeing me. So I did what I was going to do in that case. I ran a stool test.
Yep.
And I run functional medicine stool tests. They're, it's a large net that I cast. I think that was even before SIBO. So I wasn't even provoking my stool test back then. I ran a stool test. She had stool tests run by lots of providers in the past. Yep. And what came back was giardia on my stool test.
Like borderline or like really high?
It was an elevated number on the test.
Yeah.
And so I was talking to her and I was like, well, this is what we found. I feel like we should treat it. Your symptoms match it. I'm surprised that no other test has found it.
Yeah.
But that was also probably before PCR was as available.
So they were doing O&Ps.
I think they were doing O&Ps back then. And so I was like, okay, well, my favorite treatment for this, which is not necessarily standard of care. By the way, she had had lots of antibiotics. So she had metronidazole before. She had amoxicillin before. I was like, my preference is, can we treat this with nitazoxanide? Nitazoxanide.
Wait, isn't metronidazole supposed to be?
Yes, that's the standard treatment.
Yes, standard treatment is metronidazole. She had been treated with metronidazole.
How many days is the standard treatment?
10 or 7 or 10.
I don't remember off the top of my head. It's in that ballpark.
Yeah.
Huh. Okay.
She has done it. So I was like, I think we should use. So it goes by brand Alinea. Right. I think we should use brand Alinea medication. And they
didn't compound it then. Right.
I think I got her brand. I think I got her a 3-day course.
Yeah, I think it's
standard.
That we have that compound.
And so what happened was she left. We went over the results. I gave her the nitazoxanide. It's gonna kill me. Okay, got it. Yeah. I gave her the medication. And then she came back, like, I think 2 weeks later for a follow-up to see how we were doing.
How long of a course?
I think that time 3 days.
Because that's what insurance covers.
Yep. Right. That's what we did. 3 days of a course that time. Yep. She came back She had not woken up with diarrhea and not had diarrhea since she started the first pill of Alinea, right? It just stopped.
And you did twice a day.
I did 500 milligrams twice a day for 3 days.
Yep.
Standard of care for travelers diarrhea. That is
Yeah.
the standard prescription. Her diarrhea stopped.
And how many years did she have of diarrhea?
4. No, 7. Hold on. It had been a long time.
Yeah.
It had been
Too long.
I had only recently seen her, but she had been she had seen everybody. And
Right.
she came to me because one of my coworkers in the clinic was helping her with a scleroderma.
Okay.
And they were like, you need to get this diarrhea results. Try Dr. Gurevich.
Totally.
After the first pill, she started having foreign bowel movements. And then she came in and then she's like, well, like I do my usual intake, when was your last period? Oh, well, I'm late. Oh, well, I'm late. But she's like, but it doesn't matter because I'm infertile. Like we've been trying to have kids for a long time. I can't have kids. I'm infertile. At 27 years old, she's infertile, right? And I was like, oh, I just gave you this antiparasitic drug. Can I just run a pregnancy test?
Totally.
And I did. And she's pregnant.
What?
And then I am like, oh my God, what's the risk? Is there a teratogenic risk? And what I did was I reached out to one of my gynecologist coworkers, one of my colleagues, and I texted her and I was like, I didn't know she was pregnant. I didn't run a UA beforehand. Is this a problem? She had the librarian at her hospital research the pharmaceutical.
Amazing.
This is important in part 2.
Yeah.
She had her research the pharmaceutical and she texted me back and she was like, nope, they say it's completely clean. No teratogenicity, does not seem to, it's been around for a long time, doesn't seem to cross into the placenta.
Wow. That's a hot tip.
It's a very hot tip for part 2, but we're not there yet. We're not at part 2 yet. Okay.
Does that mean this pregnancy didn't hold?
Hold on. Nope. The pregnancy totally held.
The diarrhea came back?
No, the diarrhea did not. Okay. Pregnancy totally held. She did not, we had her better. I think she saw me like maybe 5 times.
Okay.
I just kept on being like, is it still good?
Yeah, totally.
Let's go another month. Let's go 3 months. Is it still good? Pregnancy totally hold, had a healthy baby boy. Then she was having a little bit of a hard time getting pregnant, worked with one of my colleagues, was able to get pregnant. And then, so now she has 2 babies. Her littlest one, her oldest one is probably like 5 now. Her littlest one is probably like 18 months.
Okay.
And she comes in and she's back on my schedule and I haven't seen her in a long time. And when that happens, I'm like, oh,
I know it's never good news.
Yeah. Like I like keeping in touch with my patients, but I also like to not see them because then they don't need me. Right.
Yeah.
And so she gets on my schedule and she's pregnant with her 3rd baby and it's back. It's back. I think when she came in to see me, she was 13 weeks pregnant, Bristol 7 bowel movements, waking up like 4 to 7 times a night, having bowel accidents because she's waking up mid-stool. She luckily can structure her day at home so she can run to the bathroom, but I mean, easily 10 to 12 bowel movements a day. She's pregnant, so nobody's going to smoke her.
Right.
So I am getting creative and I'm like, well, she's pregnant. Maybe let's try some things like we didn't. Okay, let's try fiber.
Yeah.
Can fiber firm up your stools? No. Okay, let me look at what's safe. Okay, how about a bile acid sequestrant? Maybe it's a bile acid diarrhea. Can that firm up your stools?
It didn't do anything.
Not a thing.
Wow.
Okay, next, and this is, I'm like extending. Okay, is it enzymes? Can we do enzymes? Can you try these enzymes?
It's
Can
such
you try
a short list. We can't use a lot of our herbs.
Right. It's tricky. Yep. And, does your OB understand how severe this is? Totally. Because also she's a little bit why are they not referring her to gastro? She is having 8 bowel movements a night. She's not sleeping. She's got a toddler and an older kid. You know what I mean? She's pregnant. She's not sleeping. Yeah. And fine. Okay. No, nothing. I think I treated her 4 times. I think I was seeing her every other week or maybe even like every 10 days. Cause I was like, is this working? Let me try the next thing that's safe. There's this great website, just so everybody knows, called Med Rocks, Botmed Rocks. And it has a database. Eric Yarnell puts it out. It has a database for herbs that are documented safe in pregnancy. It lists animal data, human data, no data, anecdotal evidence. So I'm like looking at what I can use through there. I'm using at the pregnancy websites. I'm doing all of that. And then I'm like, you know what? We had this experience a long time ago where Alinea really worked. I'm reading about, I remember they looked it up. I remember it was safe in pregnancy. I don't love the idea of like throwing spaghetti against the wall, but I also don't love the idea of running a stool test that's going to take 3 weeks for me to get
Yeah.
results back. She's suffering. Interestingly enough, she was not losing weight. Baby was growing appropriately and she was holding her weight stable,
Yeah.
but she should have been gaining weight.
Yeah.
So she wasn't losing weight and baby was fine, but it just wasn't great. And so I was like,
Did you do even a conventional?
oh my God. So she's not only working with me, right? She's got her OB also and her primary care.
And
They
didn't show up.
Nope. They did a PCR. They also did multiple C diffs because she's sounding really C diff.
Yeah.
You know what I mean?
Yep.
But nobody would scope her because of the anesthesia with pregnancy.
Yeah.
And so I was like, fine, this is the last bit of spaghetti against the wall. If this doesn't work, let's run a stool test and see what I find.
Yeah.
And so I was like, let's retry the nitazoxanide. Nitazoxanide. Let's retry and at this point we can get it compounded. What I mainly do right now is I get it compounded.
Yep.
They compound at 250 milligrams a pill, and you're supposed to take 500 twice a day. I got it compounded. They sent her the prescription, but she misread. She was used to our first dosing.
Oh.
And so she was taking 250 milligrams twice a day.
Oh, so she underdosed.
And it
worked?
Her the bowel movements at night got better, but she was still having too many bowel movements that were loose during the day. So then I was like, okay, let's just take the regular dose. Let's take 500 milligrams. Let's go 500 milligrams twice a day.
So you did 6 days total.
No, I did 14 days.
Oh.
I did 14 days. It had been, I think, 10 days since I saw her last and she was doing a lot better. Oh, I know what she is. She emailed me, she portal messaged to say, I'm doing a lot better. What do I do about the stool test? And I was like, let's not do the stool test. Let's save the money. It's a pricey test, let's keep you going. Okay, now let's bring you to the therapeutic dose. She was
good.
Gone again.
You don't have to leave the U.S. to get
So
Giardia or protozoa. So
yeah.
You think you were treating a protozoa that they just didn't find on their tests?
I think that PCR finds things better
For sure.
than ONP.
Well, or nothing will find it, but it's a broad spectrum drug.
Yeah.
So
right.
Yeah. So I don't know what I was treating.
Yeah.
I have no idea what I was treating.
Yeah, but
I also don't understand potentially her scleroderma makes her more susceptible.
Yep.
Right.
And there is data on Alinea or nitazoxanide. Okay, I'm working.
Yes.
I'm working. For bacterial overgrowth, for SIBO. Like it's a broad spectrum, very safe.
That's amazing. It's safe in pregnancy.
It's safe in pregnancy. And it like completely resolved her diarrhea. So I had her do, so I meant to have her do a 14-day course, but it ended up because she started with a 250 twice a day.
Right.
It was a longer course. She was doing really, really good. She was sleeping through the night. Her energy was back. She was feeling great. 4 days later, the diarrhea came back. So I now have her on 250 milligrams
every day.
We're trying it. I want her to take some breaks because she's still pregnant. It is safe, but what we don't know is what we don't know.
Yep.
But I also don't think it was safe for her to continue to have the diarrhea she was having.
Are you giving probiotics?
She's on probiotics. She's eating fiber. She's eating fermented food.
Great.
None of that stuff touched it. That was the other thing I did.
To kind of keep the balance.
Yeah.
She needs the,
And I did high dose probiotics with all 3 classes for her. That was one of the spaghetti I threw against the wall. I threw it all against the wall. Something about her and that drug.
Yeah.
And thank God it's a tool that I can use in pregnancy.
Yeah, that's amazing. Because, it's really hard. People who have microbiome issues in pregnancy.
It's hard.
We can't use a lot of our herbs. None of us want to give antibiotics.
Yeah.
Those are like, very significant cases that we would do that. So that's amazing because it does reach a lot.
And I also was like, because it was the same ending twice.
Yep.
Yeah, it was great, actually.
Yeah.
It was
totally.
Yeah, it made me very happy.
Yep. Amazing. Amazing.
All right.
That's my super speedy case.
Cool.
Thanks, guys.
Thanks, Turds.